Now, for the next thing we should be discussing is students were asked to discuss about what is hematogenous osteomyelitis. Okay, students were asked to discuss what is hematogenous osteomyelitis. So hematogenous osteomyelitis, to me, is simple if you just try to define your terminologies. Okay, so anytime you're talking about anything hematogenous, it's actually blood spread. Okay, blood related. Okay, it's actually blood related. So osteomyelitis is inflammation of the bones, of course. So let's quickly discuss hematogenous osteomyelitis. Okay, so it's actually a bone infection, and the bone infection came about because the infection spread through the bloodstream to the bone. Remember that it could actually spread through different routes. It could be direct inoculation, it could be through lymph nodes. Do you understand? So it's actually most common in children, but can actually occur at any age. Usually affects long bones like the femur, the tibia, the humerus. So what's the pathogenesis? Sources of infection. Usually bacteria will enter the bloodstream from another site. Like there was a different infection in different place, but these bacteria successfully got into the bloodstream, and so they were able to spread to the bones. So microorganisms will lodge into the metaphyseal region of the long bones. Okay. So the inflammation and necrosis. So infection causes pus formation, increased pressure, vascular compromise, and bone necrosis. So it will now cause the normal sequestrum and involucrum. Sequestrum is dead bones. Okay. Then at least some reactive bones around it. That's involucrum that we know. So common causative organisms in children, you have these issues coming from things like Staphylococcus aureus, Streptococcus, Haemophilus influenzae. In adults, Staphylococcus aureus. Okay. Then in people that have sickle cell disease, it's usually caused by what? Salmonella species. Okay. I have the pictures all around here. So clinical features is this thing is actually involved in your bloodstream. So you're having fever, chills, malaise. Okay. Localized signs like severe bone pain, tenderness, swelling of the bones, swelling of the skin even. Okay, and warmth. If you try to touch the place, it's really warm. So systemic signs like leukocytosis, so white blood cell counts are shooting up and all of that. So complications, it will lead to abscess formation. Okay, chronic osteomyelitis. Okay, and it could actually lead to fractures. Okay, fractures, weak bones leading to fractures. So you diagnose this with blood culture. You culture the blood so that you can be able to pinpoint which microorganism is causing the issue. Okay, X-rays. Okay, do X-rays, MRI. Most sensitive for early dictation, bone scans, okay, to check out for the weak bones and all of that. Then biopsy. Okay, this is where you maybe are suspecting that there is a cancer or something, so you take biopsy to the lab just to know that it's actually an infection. Treatment is usually bacterial causes. Okay, so use antibiotics. Then sometimes if there's abscess collection, you can surgically drain it or debride the wounds. Okay, then supportive care is where you do all those pain management, mobilization. There are chronic cases may require removal of the sequestrum and reconstructions. Okay, so that's what we got for hematogenous osteomyelitis.